This podcast is sponsored by CSMI, the maker of the HUMAC Norm isokinetic system. Purchase a new or refurbished machine, or you can even upgrade an existing system to bring it up to date with all the latest testing and training applications. Please visit csmisolutions.com to view all of their available products, including the HUMAC Norm isokinetic system, the HUMAC Balance portable computerized balance system, and Sportswear Online. CSMI. Better data leads to better results.
The Everything PT podcast is sponsored by Vald Performance. Vald is the creator of the airbands for blood flow restriction therapy. If you are looking to stay up to date with today's post-surgical modalities and adding BFR to your clinic, please visit valdperformance.com. Hello, and welcome to the Everything PT podcast with Matt Taylor and Daniel Bodkin. Please do not consider anything you hear to be medical advice. Just a couple of guys ranting about everything PT. Enjoy the show.
Hey everybody, Daniel here. Today we had an awesome guest on the show, somebody that was pretty integral to my educational background. And the conversation steered a couple different directions, and there was so much good content that we decided we're going to split it up into two parts. So sit back and enjoy part 2 of our conversation with Dr. Jeff Konin. And if you haven't already, go back and listen to part 1. All right, so the main reason, everything we've already talked about is tons enough for one episode. Right. But what really made me think about asking you to come on was your knowledge and everything you're doing in the world of CBD and sports medicine. All right. Like most PTs or even just most individuals out there, I know very little about that. And given that, we work in the business of pain and in recovery, we should be educated about it a little bit. So I really wanted you to come on to kind of teach us, but also teach anybody who's listening, what is CBD and what is its role in physical therapy?
Yeah, so this really is a whole other episode by itself because you've already taken the first step to recovery, and that is admitting what you don't know. And I can just tell you in my travels, I just wrote a story about this and did a podcast the other day about this. I've learned more about leadership in this space than I have about CBD or THC or anything. What I mean by that is it's basically 3 groups that I interact with. There's a group of individuals who want to learn about this. They want to figure out, is there a place for this in our practice, in our organization? We don't know, tell us, and then we'll decide from there how best to implement it. I don't tell you what to do, but here's what you need to be educated on. Those are tremendous leaders. I work with, for example, Nick Saban, Alabama, Kirby Smart, Jim Harbaugh. These are people that I work with at their universities. They're winners for a reason. They don't leave anything unturned. They look at every possible area that they can learn about, get educated on, know the benefits, the concerns, the risks, things like that. Then there's a group of leaders that are sort of in the middle. They're good leaders. They're not great leaders. They're good leaders. They're watching. They're aware. They know what they don't know, but they're not ready to dive in yet. They want to see what other people do first and where they go with this. And then there are just bad leaders. The bad leaders are the ones that I say the word cannabis and they hang up on me, or they don't return an email or a phone call and they tell me they know it all already, or they're not changing their policies, cannabis bad, all these things. And I've learned a ton about this. And so the bottom line is, this is all about education. Right. I believe, and I've spoken at the APTA's education leadership meeting before about how to integrate this knowledge into the curriculum, because it's got laws related to it, right? It's got socio-cultural issues related to it. It's got therapeutic benefits. It's got risk. This can really go, and the endocannabinoid system can be taught, and anatomy. I mean, this is something that crosses all aspects of a curriculum. It's not a 1 hour or 2 hour lecture. And you're right, there are some significant things to learn. So let me tell you a brief story how I got here. Because when you knew me, the word cannabis or marijuana was never probably uttered from my mouth, right? It wasn't in my, where do you want to be, Jeff, in 2 years? I was on the West Coast At the time, I was teaching 3-day workshops on sports concussion. And out west, there was a physical therapist in the room on day 2. And he said, I have a question for you. I live in California. And if I have a patient that shows up on my schedule tomorrow with a concussion assessment as a diagnosis, should I contact them ahead of time and advise them not to smoke anything before they come in so I can have a good baseline evaluation of their memory and their balance and so on and so forth? And I'm thinking, I don't deal with that. Wow, that's a great question, but that makes sense. That's a pretty good idea, actually. And we always want a good baseline. So yeah, absolutely. And I felt comfortable giving him that answer. I literally turned around to advance my slide. And he says, oh, I got another question for you. And you can see all the people in the room. There's like 60 people in the room are just kind of looking at him like, where's he going now? And by the way, he had sunglasses on. I think he was eating gummies all morning too. But so he says, well, what about that same patient that I've been treating now for like 10 days and they're not getting any better? They have migraines, they have anxiety, they can't sleep at night, they're falling asleep, difficulty. Should I encourage that person to take a little bit of THC, like recreational marijuana, see if that helps? Because that's what it's for. And now I was like, I don't know. And I'm pretty sure I probably shouldn't even give advice to that question. But it triggered a thought in my mind, and I went back and I tried to read up on it when I got home. And what I realized was, over half the country has laws that allow this. And this is a real thing for many physical therapists and others in their settings. So why isn't anybody talking about this? So I then spent a couple of years, literally, a lot of time and a lot of my own money to go to conferences, to take online courses, to read books, study as much as I could about this. And this was before, the Farm Bill passed a few years ago that created the legalization of what we now know as hemp or CBD products. And again, we could have another podcast, which would be, I think, really, really helpful just to tell people the difference between what hemp really is, what broad spectrum and full spectrum and all the types of labeling, because at the end of the day, it comes down to understanding what is in a product and what cannabinoid, which is the many particles of the plant, are designed to provide therapeutic benefits for what conditions: pain, anxiety, inflammation, etc. For the record, many, many years ago, there was only one patent in this country ever approved for CBD, and the federal government held it. So they knew that there's some benefit to CBD, and their patent for CBD was as a neuroprotective agent and anti-inflammatory. So yes, exactly a lot of the conditions that we deal with, right? And so from there, I just got really, really fascinated. And then around these last couple of years, you've seen more laws pass. Now the laws are passing, by the way, with lack of scientific evidence. What do I mean by this? I mean, the jury says we don't have any clinical trials on humans with this, just because it's Schedule I drug, which is in the same category as heroin, LSD, cocaine. I can't do a clinical study on any of those products. I can't do it on marijuana. But what happens is you have people in the voting age groups, the higher groups of voters, the elderly, that have lots of medical conditions, that are tired of multiple pills and expenses on their pharmaceuticals. And their neighbor says, hey, you should try this. Somebody gave me this. And it's a CBD product or a derivative of one of the cannabinoids, and they get better. And their symptoms diminish or go away or controllable or manageable. These people aren't crazy. I call them an N of one. It's not a really good controlled study, but there's N of ones everywhere. And these N of ones vote for legislators to get into office to pass these laws. So the laws are passing because people are getting better. They don't care about our evidence. They don't want to wait for the evidence. And that's the fascinating thing about this. So I started realizing that, we need to know, because if a patient comes to you and brings a product in and says, hey, this is what my neighbor gave me, what do you think? You have 3 choices. You can't say, I don't know anything about it. That's your job. You should know something about it. You can't say, oh, no, that's illegal, get rid of it, because that's not necessarily true with the product. Your responsibility is to say, you know what, let me take a look at this. Let me look at the label, see what's in the certificate of analysis. I can tell you what cannabinoids are really in here, if any, for that matter. And then I can tell you if the ones that are in here actually are proposed therapeutically to do what they should do to match the symptoms you're having. So there is a science behind this. We just haven't educated people about how it works in the body. It's been very, very fascinating to me. So I do think it has a role. It's not a magic bullet. It doesn't cure everything. And it just, the best example I could think of is you walk down the aisles of your pharmacy, CVS, Walgreens, wherever you shop, and you see the multivitamin, right? That would be the entire cannabis product. But then you see isolated ones. So you see vitamin A, vitamin D, vitamin C. Well, that's CBD, CBN, CBG. They all have different functions. And so some are believers of take the whole vitamin, use the whole plant. Others say, well, I can take it all, but I can't have THC in my system because I can't test positive. But where I've sort of made a consulting niche, if you will, the education part's fun and it's easy. And like you said, a lot of people don't know any of this. But the fun part for me is to go into universities, pro teams, and talk about athletic performance. So for example, if the NCAA says that if you have THC in your system and it's at the level of 150 nanograms per ml, that's a positive test. That's what we've been looking at for years. Okay, the athlete gets a urinalysis and it's either positive or negative. It's positive, we penalize them. They try to do everything they can to mask the test so it doesn't show up that way. I don't care about that anymore. What I care about is explaining to people that, okay, look, if you have 149 nanograms in versus 151, yeah, difference between positive, but they're saying to me, this much nanogram in your system is going to impact your performance in this way. Here's what it does to your reaction time. Here's what it does to your thinking process. Here's what it does to your cardiovascular endurance if it's in your system through vaping or smoking. And so this has been more impactful to the athletes and the patients to know, because THC right now is very popular. It's the society has changed. It's become much more acceptable, especially in certain cultures. You can no longer go in and say no to marijuana. Now, you don't have to go in and promote it, but if you think back to the days of alcohol and sex and all those things, none of those say no to campaigns worked. So my campaign is not say no, and it's not go ahead and do it. It's let me show you, if you make this adult choice to do it, here's how it impacts you. So now when I'm talking to an elite program, whether it's the individuals on the team or the entire team as a group, and they're looking to get to a bowl game or to be drafted or things like that, I can say, look, I have no skin in the game. This is you. I'm going to educate you and show you, though, here's the difference between your physical performance in the weight room, on the field, in the classroom, whatever it might be, with and without this much THC in your system. You decide how to understand how to manage that within moderation.
Yeah. Jeff, just a real quick follow-up story. 5 or 6, probably like 6 or 7 years ago, my dog had awful seizures. Had a brand new pup and had awful seizures, and we had not heard much about CBD at that point. And then we had a vet, I think, recommend it, and we ended up trying it. Didn't have a seizure for well over a year before he had his next set of seizures. So that is the point when I knew, okay, there is something to this, but I don't know what exactly. But it was kind of on my radar then, and it just kind of blew up the last few years, though. But
yeah, and I'll be the first to admit, I'm not a pet expert when it comes to cannabis.
Sure.
There are a lot of questions about that too, but I just have no familiarity with dosage and application type and things like that when it comes to the pets.
Sure. It's just that you mentioned the N of 1. That was my N of 1 story, my first dealing with it.
Yes.
Yeah. With a dog, not even a human. So
well, when I was outside of Nashville, I had this one patient, and he'd come about every 6 months. Just chronic low back pain. And he'd get better, then irritate his back and come back. And it was about his second or third time. I said, hey, so what do you do to manage your pain? Like, it was really bad pain. So I was like, because I know that he was getting prescribed opioids at the time. I was like, what do you do? He's like, I don't take those. I just go smoke a joint. I was like kind of thrown back. I was like, really? He was a good old boy from the country. So I wasn't expecting that, but he's like, oh yeah, I do that. And then I'm able to, get about my day. He's like, yeah, my back still hurts, but I'm able to function. And that's really when I started to think about like, oh, there might be something to this. And that's right when, the big lawsuit against Purdue and the opioids and the big opioid crisis that we're having in the U.S. was occurring at the same time. So it kind of really made me think about it.
So think about this, because the world is different, as I mentioned. Athletes are avoiding alcohol in lieu of cannabis. And the reasons are alcohol gains weight and has a hangover the next day. And they don't have either of those two when they're using cannabis. So this has sort of been a go-to transition for them. But what people haven't addressed is, and I've mentioned it relative to performance, but think about your average patient in the work world. If they're having anxiety issues and they're recommended a small, we call low dose of marijuana at night to sleep better and relax, right? They can take a very, very small amount from a vape at say 9 p.m., sleep like a baby, wake up the next morning, feel refreshed, anxiety's gone, etc. And they go to work and they perform great at work. But in the workplace setting, they're not protected by the federal law. So if they are subjected to drug testing, they could test positive. You could also put marijuana in your system tonight. 2 weeks from now, fast forward the clock, you roll through a stop sign, you get pulled over, cop doesn't like you, subjects you to urinalysis or anything, and marijuana comes up in your system. Is it likely that smoking something 2 weeks ago impaired you when you rolled through the stop sign? Absolutely not. But we don't have good science right now to correlate performance and usage. And that's my space right now. That's what I'm really trying to focus on to make a difference. Because I've been contacted by a handful of attorneys who have had similar cases like this, where their clients had an issue at work. And then when they went to get medical treatment, for example, the blood work at the hospital tested positive for marijuana, and the insurance company refused to pay. And then some of them lost their employment setting. And the reality was they were actually a better employee because what they were using was done therapeutically under the guidance of a physician. And no one knew that because you don't tell your employer the rest of your health history all the time. And so it's just kept under the wraps for no other reason. And I don't tell my employer if I have high blood pressure or diabetes or anything else. It's just what we do. So there's so much more to learn. And as we started off here in this conversation, figure out how it impacts what we do with our patients.
Hey, Jeff, just a real quick follow-up question. I'm curious your thoughts about, the NFL has a huge problem with CTE, obviously coming to the forefront. Concussion is at the front of their minds. Where do you think that cannabis, CBD fits in the future of the management of these conditions?
That's a great question. So I think it's important to divide up when you say cannabis, the ones that have euphoric effects versus the ones that don't. So the THC, which is technically Delta 9, Delta 8, Delta 10, and some people would even say CBN has some psycho properties. They're very, very different than the other cannabinoids that don't. And so it really depends on the goals. As I said earlier, CBD itself without THC has been shown to have neuroprotective healing properties. In other countries, for example, in Israel, they're studying this CBD relative to Alzheimer's and Parkinson's and MS and any type of progressive neurological disease to see if it can serve as a prophylactic or slow down the progressive disorders. In Australia, there's a place called the Lambert Institute. They've actually published a white paper and submitted it to the government and proposed the following. Now think about this. Individual who's a surgeon who develops early tremors from a neurological disorder can use a low dose THC to control those tremors and be safer in the OR. Same for driving. You're getting older as you're driving, your vision's fine, your thought process is fine, but you have these uncontrollable tremors. But low dose THC can remove those, and now you're a safer driver. This is I mean, we never would imagine talking about this in the past. And I don't know if that's we'll ever see that day or not. But the question you have, I've done a number of concussion presentations relative to cannabis and the connection of where it is. We might find out someday that it's a prophylactic. It helps minimize inflammation after a hit. It might decrease the axonal shearing. We don't know. A lot of theoretical approaches based upon what we know how the cannabinoids interact in the body.
Well, another big issue the NFL has, and just sports in general, is psychosocial. You hear, so and so gets arrested for assault, domestic, this and that, and you wonder, okay, if they were allowed to have this as a treatment, because a lot of the medications that people will take for anxiety, depression have a lot of other side effects that aren't conducive to sport. So you just wonder where will it be, or even sports performance anxiety is huge.
There's so many angles. I mean, just prior to our call, I was in a conversation with a former NFL player who was the first in the history of the NFL to apply for a TUE, which is a therapeutic use exemption to use marijuana. The individual had a pretty devastating chronic ankle injury that required surgery, and essentially got addicted to opioids. Got off the opioids, used THC, and didn't have the addictions. I was monitored and was benefiting from pain relief. But the NFL, turned down this use of this to still play legally, and still does. Has not allowed TUEs. But this person is on a mission now for his life to bring in others to help do research on this, to show, how did he get these benefits? How can others benefit from it? And is there a use for this in the future for football, for example? You got guys that are playing in pain every week. I mean, I sent a text to one of the college teams that I worked with just last week, on Sunday morning. And I said, how did you guys make out in the games? Everybody healthy? And he wrote back, he goes, it's week 10. Nobody's healthy. Everybody's injured at this point. And so there is some truth to that, and that's just football. Other sports are like this, military obviously like this. Some person's jobs are like this. And so we have a lot to learn. And I think it starts with the education. It starts with, as I said, being open-minded to wanting to learn, then looking at where the science will take us, and then how can we apply what we learn in the science to find benefits, but also being open-minded that, as I said, it's not going to cure everything. And there are side effects. There are some risks you can take. You can still develop an addiction. You can develop a psychosis behavior towards too much THC. You have the risk now of fentanyl-laced products that are really scary out there in this world. There are some contraindications or precautions with certain medications you might already be on if you're taking CBD, for example. In other words, when the CBD is in your system, the way it works is it binds to receptors. But if it binds to the same receptors that a medication you're taking is already supposed to bind to, what does that mean? Does that block your medication from working? So there's so much more to learn that's out there. And to me, it's fascinating. It's fascinating to me for two reasons, guys. First is that, we just don't usually come across something new and exciting in what we do. We tend to rehash, so there's another ACL study and whatever. And so this to me is exciting and it's different. And it's more exciting because I've made a living being opportunistic and finding a niche that's new. So for me, this is still very new, and it'll probably still be new to a certain extent by the time I even, stop doing all of this. But there hopefully will be a whole bunch of other people carrying the torch as well and learning about it and deciding how to implement it if there's a place for it.
So Jeff, I have a question. So for that clinician who's really wanting to educate themselves, do you have any links that you can provide us that we could throw in the description of the episode, or anything off your head that you can think of that they could go to?
Yeah. So from a self-serving perspective, I would direct them to drjeffkonin.com, which is my contemporary cannabis consulting website that shares with you the types of things you can learn, opportunities to get better in. But then, what really, don't Google. There's a lot of garbage out there that's promotional from industry. Use your typical PubMed type search, a scholarly search, and use your keywords. And then what I would simply suggest is when you come across, if you're looking at this for pain or you're looking at it for anxiety, use the keywords. And then when you come across a recently published article, so in this space, there's two really kinds of good articles. One of the historical ones, that are published in like the late 80s and early 90s that talk about the finding of the endocannabinoid system and the finding of CBD. These are historical and good to read. And then you have the ones that are of the last couple of years that are more clinically relevant contemporary studies. And when you find one of those, then just look at the reference list in there. If it's a good study, and you know how to analyze studies, if it's a good study, then probably it's only utilizing good resources and references as well. And that's a great place to start versus just continually trying to find one at a time. It's a limited, if you search, you're going to find 25,000 articles. For those that say there's no studies, that's BS. They're there, but they're animal studies, they're poorly designed studies, they're low ends, the methods are bad. There's a lot of flaws to them. And so, I think most of us already have the expertise on how to analyze, critically review a study, but really fine tune what you want. The space is so large. You can't just say, what's a good cannabis study? What do you want to learn? Cannabis and inflammation, cannabis and pain, cannabis and anxiety in a certain age group, whatever it might be. So you just follow the same pathway you normally would if you're trying to search something else that you're interested in.
Awesome.
Again,
So,
what was that? What
That
was
was
your website?
drjeffkonin.com.
There we go.
Thanks. They were on the same wavelength there. Thank you.
Dan, you have anything else for Jeff today?
I don't. I think we
got all my
kept them
questions.
long enough.
I know.
Let's do this again, guys, and let's do a sole focus on this. And if you have an audience, reach out to them ahead of time and ask them what questions they want answered, and we'll toss them out there, and we'll do our best to educate. To me, that's the most important thing is to, what's that old saying that you can give someone a fish and they eat for a day, but if you teach them how to fish, they eat for life. And that's really what I do when I consult. I give people enough information that they need to know in their setting, and then they're more than qualified enough to take it from there and figure out where they should go.
I think just the ability, Jeff, to just be open-minded and challenge, our confirmation biases, and challenge ourselves what we think is true, by the science and evidence. And that's how we learn. We're lifelong students. And it's incredible how much I've learned from day one to today. My therapy from day one, I'm embarrassed of it and what it looks like today. So continue that lifelong learning. And I think it'd be wise to do something like that with you again on this topic.
Sounds great. Thank you, guys. I appreciate it.
Yeah, thank you very much for coming on.
Awesome. All right, guys, we will catch up with you next week. Thanks for tuning in. See ya.
Looking for a way to improve sport-specific training with your athletes? Then you have to check out Blaze Pods. Blaze Pods is a neurocognitive reaction training intervention that can be incorporated into your sessions for patients throughout the treatment spectrum. Visit blazepod.com. Enter code EVERYTHINGPT at checkout and save 15% off your order today. Hey, all you rehab specialists out there. Do you have an isokinetic dynamometer just sitting around your clinic not being used? Little known fact, isokinetic machines that aren't used regularly are at higher risk for bouts of sadness. Help your machine out and take CSMI's newest CEU course, Isokinetics 101 online, created by me, Daniel Bodkin, and learn how to use all the exercise and testing applications available on your machine. With new and exciting rehab techniques in your toolbox, your sad isokinetic machine can become an active member of the rehab team again and regain its happiness. Isokinetics 101 online by CSMI has been approved for 8 credit hours for athletic trainers, physical therapists, and physical therapy assistants. Contact your state board for details on specific requirements. This course is available at humacnorm.com/courses/isokinetics-101.